Let's try again. Okay.
On behalf of everyone at UNICEF, greetings to everyone attending this year's World Local Production Forum. UNICEF counts on local production across our work. We recognize that when products are manufactured closer to the people who need them, supply chains are more efficient. Shipping costs are lower, shipping times are faster, and our operations have a much smaller environmental impact. And that is why local production of quality-assured medicines and other health technologies are such an important part of our work, especially in low and middle-income countries. And that is also why we work closely with our sister agencies, governments, and industry partners to boost local production capacity. This includes market shaping and strategic procurement of essential health products like vaccines. It also includes supporting local production of ready-to-use therapeutic food, a vital weapon in the fight against severe acute malnutrition. For 2 decades, we've worked to develop and expand supplier bases in countries and regions where this product is most needed. And as of last year, 70% of the ready-to-use therapeutic suppliers based in program countries. The COVID-19 pandemic has further highlighted the need for local production. Personal protective equipment, or PPE, is a great example. When demand for masks, gowns, and other products skyrocketed in 2020, the world quickly realized the importance of supply security for such products, especially when lockdowns and transportation constraints made it difficult to procure and deliver these essential items. Since then, UNICEF has been working to boost local manufacturing capacity in the 7 regions in which we operate. And the joint tender that we issued last year yielded over 2 dozen long-term agreements covering 34 of these products. So we're much better prepared for any future health emergencies. But we also recognize that there is so much more that we can do. And that's what meetings like this one are all about. To identify more areas in which we can collaborate to boost local production and better manage familiar challenges like differing technology, infrastructure, legal requirements, and quality standards. Last year has accelerated the need for this kind of collaboration, and we have much to learn from one another. UNICEF is proud to join in this important work and to share our own experiences in developing local manufacturing capacity for products and supplies that literally save lives. Let us continue this important work. Thank you.
Thank you very much to the UNICEF colleagues that made it possible that this message reached us. And thank you everybody who was part of this opening session. We will have a plenary and a series of technical sessions related to local production throughout the week, from partnerships, business ecosystem, regulatory system, to vaccines, biologics, and innovation. But before we move to the next panel, can I ask all the distinguished guests for the opening, plus the panelists, to turn on their video so we can have a screenshot, that we can have a photograph with everyone in a nice place. We are, yes, thank you. All those colleagues who will be speaking, we have, okay, thank you, Hala. Okay, Hala, can you turn on your video? Okay, I think we have most. Just see someone is taking the picture of the screenshot. Okay. Well, thank you again for distinguished panelists that helped us to open this forum in a very constructive mode. And I wish you all the best for the following discussions. And I hand over just to Dr. Dong to introduce the next panel. Thank you.
Thank you, Dr. Simo, ADG. I'm now honored to invite Dr. Soumya Swaminathan, our Chief Scientist, WHO, to chair the plenary session. Dr. Soumya, please.
Thank you very much, Visri, and good morning, good afternoon, and good evening, ladies and gentlemen. My name is Soumya Swaminathan. I'm the Chief Scientist at the World Health Organization, and it's a great pleasure for me to introduce and chair this first plenary session of this conference, the World Local Production Forum. This session is going to really be looking at accelerating local production through partnerships and cooperation. We know that there are a variety of stakeholders and partners who are relevant to local production, and they have to work together in order to strengthen local production. It's not one stakeholder or one group of individuals who can change the ecosystem in a country. It has to span public and private sectors. It needs some support from international organizations as well within the UN and outside the UN. And it's really important that the partners and the stakeholders coordinate and synergize their efforts and resources based, of course, on their mandates and their competitive advantages. And without this kind of coordination, there is a risk of unnecessary duplication of efforts and inefficiency. So you need at the country level, potentially at a regional level as well, a mechanism or a framework that can facilitate coordination and collaboration, particularly if there are many partners and stakeholders involved. That ultimately should be this kind of coordination. And we have seen that effective leadership by governments, including long-term demonstrable commitment to the development and enhancement of local production, definitely bears fruit. But it does take time, it takes commitment, it takes resources, it takes a dedicated effort, and it requires a very good coordination mechanism. There are also big advantages to fostering partnerships within different regions, and these can contribute to regional public health security. And we've been talking a lot about this in the context of COVID vaccines. And these kind of regional initiatives and partnerships, they again need a good understanding of the strengths of each other, turning these into benefits and having a shared vision, and then having a means of effective collaboration. We have seen the benefits of the regional dimension with respect to, let us say, regulatory harmonization is a good example where WHO has been closely engaged with regional bodies, and which has been extremely effective to enhance and speed up the access to medicines and vaccines. So today we're going to hear from a number of different speakers who will address the different issues and views related to this topic. And I would like to first invite Dr. Sandile Buthelezi, the Director General of the National Department of Health, South Africa, to address us, please. Lady.
Thank you very much, Program Director. Your Excellencies, good morning, good afternoon, good evening, good night. And thank you for inviting South Africa to participate in this panel. Your Excellencies, in March 2020, the WHO declared coronavirus disease as a global pandemic. This declaration swiftly led to the global demand for access to affordable medical products, which include diagnostic kits, medical masks, other PPEs and ventilators, as well as vaccines and medicines for the prevention of infection. Sadly, the demand was not adequately supported with the supply of the required commodities, resulting in increased strain in our already fragile healthcare systems. The inequities of the current supply model during the pandemic has highlighted the challenges around supply of medicines to the developing world, most obviously in Africa. As a collective, African countries require a unified approach to tackling the challenges associated with developing local production capacity to address these inequities. Local manufacturing of medicines and commodities is therefore no longer optional for Africa. Countries are reliant on India and China as major producers of finished generic products and active pharmaceutical ingredients. Importation of medical commodities from these countries, while critical for meeting the healthcare needs of many low-income countries, has an impact on the trade balance of African countries. Additionally, very few countries in Africa are able to sustain a market by themselves, as each country has a different disease priority and a regulatory system. Therefore, different model for local production needs to be conceptualized. Sustainable medicine manufacturing is capital, technology, and knowledge intensive. Significant resources have been invested by governments, donors, and other agencies to establish the necessary systems, infrastructure, and processes in support of local production. However, it is critical that we understand that the nature and extent of these investments to identify the gaps and avoid duplication of existing structures and interventions. Of critical importance, Your Excellencies, is the development of a sufficient number of personnel with appropriate qualifications, technical skills, and expertise. And here I'm referring to chemical engineers, pharmaceutical scientists, and technicians, just to mention a few. And to this end, stronger relationships will need to be forged with our teaching and academic institutions supported by sustainable funding. Furthermore, to advance localized and harmonized production the regulatory environment of the medicine value chain will need to be aligned from legislating relating to the manufacture of medicine to the removal of obstacles related to intellectual property and strengthening the business environment. Many countries, including South Africa, are already engaged in activities related to local manufacturing of medicines. However, there is a notion that it is costlier to produce medicines in Africa. The SADC recently performed a pre-feasibility study regarding the establishment of manufacturing plants for essential medicines and health commodities. The study revealed that it is possible to manufacture the precursors and APIs for a number of essential medicines more cost effectively in Africa. Support for local production of medicines has been steadily gaining ground. To build the momentum in creating a robust and competitive local pharmaceutical industry, from manufacturing of APIs to the production of finished generic products, creating and maintaining partnerships across role players with various stakeholders. This is what is going to be critical for Africa and other low middle income countries. I thank you.
Dr. Sumia, can you unmute yourself? We cannot hear you.
Yes, apologies. So, thank you so much, Dr. Buthelezi. I would now like to call upon the Vice Minister from Indonesia, Dr. Dante Hartono.
Thank you.
And
Honorable.
Please go
Yes.
ahead. Now I'm going to request Dr. Rogerio Gaspar to just take over the chairing for a few minutes till I come back. Thank you.
Thank you, Dr. Soumya. Honorable ministers, distinguished delegate, ladies and gentlemen, thank you for inviting me in this event. I believe this event is a manifestation on how multilateralism have positive impact in strengthening partnership and cooperation among countries to advance local production for medicines, vaccines, and other health technology. For over 2 decades, we have been progressing in promoting equitable access to medicines, vaccine, and other health technologies. But the pandemic has been showing us that we need to do more. We see that promoting local production to increasing access in a crucial part of effort doing more, but acknowledgements that to be able to have sustainable local production, we need to have a supporting environment to promote local production in a global, regional, and national levels. And to be able to do so, we need to address the challenge from both demand and supply side, from upstream to downstream. This includes regulation, infrastructure, resources, and other support systems. With the resilient systems support local production, we believe one developing country such as Indonesia can fulfill these own needs as well as other country needs in a more affordable way. Therefore, in 2019, Indonesia enforced the Presidential Instruction on Acceleration to Development the pharmaceutical and medical device industry, supported with a roadmap for pharmaceutical and medical device resiliency. Indonesia has also joined the ASEAN member state in ratifying in the Asian Medical Devices Directive AMDD through Presidential Decree number 110 of 2018 to harmonize the regulatory system for medical device in 10 ASEAN countries. The AMDD reduced technology barriers for medical device manufacturing, marketing their products among ASEAN member states. Ladies and gentlemen, Indonesia commits to extend to active support global effort in promoting local production to improve.
Dr. Dante, we just lost your sound. If you could unmute yourself, please.
Yes, it's fine. Okay.
Good. Yeah.
We open foreign investment, promote price transparency through a catalog, platform, and other supporting national. But we need support global policy as well as collaboration and cooperation among countries, bilateral, regional, and multilateral platforms. This is an important thing to increase and maximize local production. I thank you.
Thank you very much. And Isabel Duran, Acting Secretary General of UNCTAD. This is Isabel Duran. The floor is yours.
Thank you, Dr. Gaspar. So first of all, and I don't want to repeat what was said by the excellent colleagues in the opening session on all the characteristics or all what we need. Just to complement what Mr. Yong Lee from UNIDO and Madame Gozi said about trade. So first of all, you have to know that UNCTAD's World Investment Report in 2021, so just published today, has surveyed 70 economies and found that restriction on investment in health are rare. And in fact, most countries have put in place policies to promote investment in the health sector. That is, of course, a good news, and it demonstrates the political will and also the change in mindset caused by Dr. Tedros, and maybe he has been heard. Secondly, I would like also to be very concrete regarding the productive capacity and be very concrete based on the experience of UNCTAD in the previous years, even before the COVID. Of course, it's important to note that investment in policies are not sufficient. And we need, first of all, a lack of technology and skills, which has to be improved. Also, the low regulatory capacity, the weak policy coherence, the small and fragmented markets, and the poor infrastructure and related services. And so it's why we need concerted action by all stakeholders in order to build and expand productive capacity in this health sector. And this action concretely are including investing in skills development and technology capacity, sharing technologies to enable affordable mass production, improving access to finance and tap into impact investment, building partnership to initiate lighthouse projects, providing investment incentives to improve local firms' sustainability, not only creation, but sustainability. Upgrading and streamlining regulation and administration, that was mentioned by Dr. Lia Tadessi, the Minister of Ethiopia, but also as Mrs. Urpilainen from the European Union. The regulatory framework is also very important. We have also to invest in infrastructure, emphasizing a regional approach to reduce cost, not only to have close industries, but also to reduce the cost, seeking funding through official development assistance, and ensuring sustainability of efforts despite a very unpredictable market. So you have also to note that the upcoming World Investment Forum of UNCTAD will take place from 17 to 21st October. And during this event, UNCTAD will host a special session that brings together key global players, national policymakers, and investors to discuss how to put the plan into action and how to improve a strategic collaboration for vaccine production. And I hope that it could be really a continuum or a way to pursue the efforts of the WTO and the WHO, which will be taken soon as announced by Madame Gozi. So in closing, I would say that UNCTAD is really proud to be part of this partnership in this regard for a long time, but also for, of course, for the present and the future. And that we will, of course, continue count on our expertise and also our experience in this regard, especially for the countries that I just heard, Indonesia and others, because we are also there to support them in their own capacity or possibility to develop the conditions for good investment in health sector and health manufacturing. Thank you.
Thank you very much for your contribution. And I now move the floor and invite His Excellency Mr. Marco Pontos, Minister of Science and Technology from Brazil, to take the floor. Minister. Well, please, can you unmute yourself? You're still muted.
Okay, can you hear me now? Okay, great. So good day to all. And I would like first to congratulate and thank World Health Organization for this forum. It's a very important subject. Thank you for the organization and for allowing me to participate. Pandemic has been a huge problem for all the countries. And for sure, the pandemic has also given us very important lessons to be followed from here on. For example, importance of science as the only weapon that we have to fight the enemy, the COVID virus. Also, the importance of working together in order to find best solutions and faster solutions. Also, the importance of local production, so we can mitigate problems of international logistics, and also to fight the differences that we've been finding about the countries. So the capabilities of the countries to find or to develop local production. Of course, many of these things have been said before me. So I'd like to focus a little bit more in the practical sense what we've been doing here in Brazil, and perhaps share some of this information that we can discuss in the next questions. First of all, in Brazil, we've been working in a strategy that we can put like in three main pillars. And we, as Ministry of Science, Technology, and Innovations, we've been working in close partnership with the Ministry of Health and other ministries in order to fight the COVID here in Brazil. The first pillar of this strategy is about the operational side. And this, the Ministry of Health is in charge, using very prestigious and efficient organizations here like Fiocruz and Instituto Butantan. They have been working with vaccines for many times. So the Ministry of Health is working in the public policies of health, working there as in the front combat, I would say, front line of the combat. And also we have a very good system for delivering vaccines. And this is something that we have here. But of course, importing vaccines has some problems in terms of logistics. We need to have the vaccines here, the active ingredient here. And so in order to help with this part, the second pillar of these strategies is we are in charge here in this ministry, working in developing vaccines. We have 15 strategies of technologies for vaccines being worked here. 3 of them are starting now the human trials or the clinical trials. And we are also developing ventilators and other equipment to help the national industry here. And the third pillar is the pillar of infrastructure. And for this, we use many different ministries, also cooperation with other countries to develop a better infrastructure for laboratories, including a biosecurity level 4 laboratory here in Brazil, and changing the regulatory legislation that we have here, and many other possibilities using local and international financing tools. So since we don't have much time here in this opening section, I would like just to emphasize these three pillars and to be open for partnership, international partnership. And I have many more details that I can share during the questions sections here. Thank you very much.
Thank you very much, Minister. I'll now move to Dr. Ala Zayed, Minister for Health and Population from Egypt. Dr. Zayed, please.
Hello, Your Excellencies, ladies and gentlemen. Thank you for this unique participation that comes in a very crucial moment in the world. Yes, the battle is still ongoing, and despite all losses that have been incurred, I believe that our world is progressing towards eliminating pandemic. No one is safe unless everyone is safe. Together, and only together through our cooperation, we are capable of coping with the current and future challenges. A lot of lessons have been learned. Most importantly, the required quick action to close the gap between the global demand and adequate healthcare services and the shortage in supply. In this regard, I would like to highlight main lessons learned so we can cooperate in allocating resources accordingly. International cooperation among countries and the international organization for supporting research and development, especially in the public health related issues, epidemics, immunology, and vaccine. Besides, the establishment of feasible platform to facilitate the transfer of health technologies and fostering the capacity of the local manufacturing. Nevertheless, to support clinical trials aiming at achieving the resilience to develop required vaccines to cope with the emerging threats. In this regard, I would like to give examples of application of above mentioned lessons in Egypt. First, promoting the local production of vital medicines and medical supplies have been an essential pillar in the national health agenda. Under the patronage of His Excellency the President Sisi, required resources have been allocated in order to foster the national medical production capabilities with the aim of providing safe, effective, and high quality medicines through application good management. As a result of the local pharmaceutical production, protected the Egyptian market from, for instance, PPE's global unprecedented shortage that many countries suffered during the COVID-19 pandemic. For many decades, Egypt suffered from financial burden of hepatitis C. Now we are so proud to eliminate Egypt from hepatitis C with local production of HCV drugs that around $50 only for the course. The national strategic vision for investment in healthcare has been crowded lately by opening of Egypt to Farm City, which is considered the largest pharmaceutical factory in the whole Middle East region, with production capacity of almost 150 million packs of medicines annually. Realizing the devastating impact of COVID-19 pandemic and the global challenges that the world is currently facing in fulfilling required needs of COVID-19 vaccine, the Ministry of Health of Egypt, in cooperation with WHO, went through several stages of assessment of Vaxera, that the holding company that belonged to the government, to review the readiness for the COVID-19 vaccine production. The WHO final report states that Vaxera is the state-of-art manufacturing facility, which could be dedicated for production of COVID-19 vaccine in the upcoming short time. Finally, I would like to emphasize on the importance of allocating required resources for investing in research and development and supporting technology transfer. Countries shall work hand in hand to support the local production of essential raw materials, development of vital medicines and vaccines. I thank you.
Thank you, Dr. Zayed, Minister of Health and Population from Egypt, for your statement. And I now will start the second part of this panel, putting a series of targeted questions to the members of our panel, so we can go in depth on the general considerations that were already performed and with specific examples that were also delivered, but going on to more depth on this discussion. So I will first address Dr. Buthelezi from South Africa and asking you what role can national, regional and global partnerships and cooperation play in accelerating local production? And if you could tell us your opinion about how can these partnerships be leveraged to promote local production, how can engagement in these partnerships be facilitated, and finally, how could all stakeholders, including civil society, be leveraged through these partnerships? Dr. Buthelezi, the floor is yours.
Thank you very much. At a national level, basically, there are a number of government departments that need to work together. For example, here in South Africa, our Departments of Science and Innovation, Department of Trade and Industry need to work with the Department of Health to create the synergies required to build a strong local industry. At a regional and global level, we know that market expansion beyond the local country markets will be crucial to create the economies of scale needed to bring production costs down. Furthermore, we know that not all countries are at the same level of maturity in terms of local production capacity. The trick will be to leverage the strengths in the areas of production in the local industry where these strengths exist, identify shortcomings which impact on efficiency and sustainability, and then implement programs of redress so that we are able to address these issues. Key to this is ensuring that all country stakeholders are aligned in terms of regulatory requirements, especially when market expansion and food procurements are contemplated. Additionally, a lot of work has already been done by agencies and donors, which needs to be interrogated and integrated in plans that are being developed. In the spirit of global solidarity, we will need to proactively manage the relationships with stakeholders, be they the regulatory authorities, UN organizations such as WTO, as it pertains to IP, donor and funding agencies and academic institutions by doing the following. One, implement the proper governance structures with strategic plan that will clarify roles of authority, responsibility, and mutual accountability. Implement management structures to promote interagency collaboration at administrative and other levels, both and in between organizations. Implementing and monitoring evaluation processes to ensure alignment of all role players and as means to measure impact so that course correction can take place if needed. Lastly, and probably the most important, especially when the number of role players is communication. The need for open and robust communication that sustains processes that are credible to identify and address challenges cannot be underestimated. These are complex environments, and the addition of various role players, agencies, donors adds to the complexity. We need to acknowledge this, and with discipline and focus, we must ensure that we are able to realize our goals. Thank you very much.
Thank you, Dr. Buthelezi. I will now put the same question to Dr. Dante Arguono. Dr. Arguono, please.
Thank you, Dr. Gaspar. The way I see it, partnership and cooperation play an important role as a catalyst toward achieving equal access to medicines, vaccine, and other health technology. both during the pandemic and beyond. I mentioned earlier, while for the last 2 decades, there are progress in promoting equitable access to these health products. The pandemic saw us that resiliency of the pharmaceutical and medical product is crucial to fulfill country needs of essential medicines, vaccines, and other health technology during global health emergency. Some of the key issues that can be addressed through partnership and cooperation are: first, barrier and challenge related to supply side of the productions, the availability of supporting global regulatory that promote local production, raw material technology transfer, and advanced skilled personnel and appropriate infrastructure are the key issue that capacity in one country that need multi-sectoral support and cooperation. Second, barrier and challenge related to the demand side of the production. Market guarantee and sufficient monetary demand are two key issues that need to be addressed to this side of the production challenge. Local production should be supported by a proper and sustainable demands that will ensure continuity of production balance and the risk that incurred. I believe we need to play our role promoting sustainable access to health product through local production. Solidarity among all stakeholders is key. Indonesia support the work of the integration comprised WHO, UNDO, UNTEC, UNAIDS, UNICEF, the Global Fund in promoting local production of medicines and other health technology. These partnerships should also be reflecting in the national level. We need to concern effort both in global, regional, and national level. In order to do so, a national working group consists of each the integration member and national counterpart might be considered to be established in country where this partner exists to promote more concert and grown effort toward promoting local production. Thank you.
Thank you, Dr. Arguano, and thank you specifically because not only you, but others before you reinforced the need for strong regulatory support to this endeavor, which is something that sometimes gets forgotten. Now I will move to His Excellency Mr. Marco Pontes, Minister of Science and Technology, Brazil, with the same question from your perspective. Thank you very much.
Thank you very much. Yes, as I see here, and as we are working in this region here in South America, first of all, virus has no borders, and also we share common problems like climate and other problems that it's not only in this region but other regions. So we have to develop a regional strategy to work together. It doesn't make sense to solve the pandemic in one country and the other countries here with borders is still fighting there. So we have to work together. And in order to do this, we have to share science results. We have to share and work together the regulatory legislation so we can share experience and use equipment that can be developed in one country and used in another country. Also, we have to work together to share the infrastructure. Of course, the laboratories, they are very expensive, and we can work together in association like international cooperation and local cooperation to use infrastructure in an efficient way. Also, in terms of financing, we can work a synergic plan so each country can develop part of this strategy and use the local market to improve the local industry for each country. So in general terms, we have to avoid wasting time, wasting money. So we can, by working together, we can have better solutions, more sustainable solutions, not only for this crisis now, and we have to prepare the region for the next pandemics. They are going to happen. So we have to work together in order to be better prepared than we find the countries for the COVID pandemic. So pretty much is this that I think about this this subject now, but we can share more information. And this one thing that Brazil has doing very well. Here we are sharing all the information that we've been developing here in new medications, new vaccines. And this is the way I think we can not only help the world, the entire planet now with this pandemic, but also learning how to do for the next ones. So thank you very much.
Thank you very much for your contribution. And to finalize the cycle about different national, regional perspectives about the same question, and before giving the floor at the end to Dr. Isabel Duran for a different set of questions, I would like to give the floor to Dr. Ala Zayed from Egypt to give us also a perspective on the same question.
Thank you, Dr. Kasper, and thank you for all this unique experience from different countries. Actually, as you know, through the collaborative knowledge and experience and shared responsibility, we will be able to take major steps in fighting and ending the pandemics. COVAX facility, AVAT working group have set a historical example of the integrity collaboration can achieve. This effective collaboration must be replicated to cover alarming health topics. To achieve such a thing, a multi-sectorial cooperation shall be initiated and leveraged. National strategies shall be developed and implemented, ensuring the fulfillment of all prerequisites for sustainable local production, creating encouraging environment to build sustainable partnership or developing a strong regulatory system that work on facilitating registration and licensing processes, as well applying incentive package for factories that have the ability of producing vital and essential products. Sustaining public-private partnerships on implementing effective technology transfer needed for local manufacturing and encouraging manufacturers to develop their infrastructures and raise manufacturing quality standards by applying good manufacturing practice. The Egyptian government saves no efforts in providing packages of incentives for fostering the local investment in health sector. As a result, the current local production reached more than 90% of the country needs. And we are progressing to achieve the total self-sufficiency in the next few years. Egypt continue to engage the global community in cooperation for achievements of humanity through contribution to the WHO Global Solidarity Trial. Besides initiating high-level cooperation with the Chinese government, we launched several promising phase 3 clinical trials in Egypt that was followed by signing 2 joint manufacturing agreement between Vaxera and Sinovac Life Science Company to local produce of the vaccine with a production capacity reaching more than 80 million doses per year. Additionally, we are negotiating with Indian Serum Institute for manufacturing, as well as AstraZeneca vaccine to produce vaccine locally. To conclude, for achievements of access to medicines and vital health products through strengthening local production, it takes a holistic approach that including political commitment at the highest level, flexible policies and sustainable access to finance the technology. This will not be done unless all stakeholders come hand in hand and work together to ensure achievements of health security for every human being. Thank you very much.
Thank you very much, Dr. Zayed, for your contribution. And I will now move to Mrs. Isabel Duran, Acting Secretary General from UNCTAD, with a different question. The first interagency statement on promoting local production was signed by the top leadership of WHO, UNCTAD, UNIDO, UNAIDS, UNICEF, and the Global Fund in 2019. The interagency statement was launched at the 72nd World Health Assembly by our Director General, together with leadership from the other signatory organizations. Can you comment on the role of interagency partnerships in promoting local production to improve access and the importance of coordination among the agencies? And furthermore, how could all stakeholders, including civil societies, be leveraged on your opinion? Mrs. Isabel Duran, please.
Thank you. No, I'm not doctor. So thank you so much. So yes, it's true that this six organization network is really important in order really to combine the different expertise. And of course, between WHO, UNIDO, etc., we have different lens, and it works well. I would insist, listening to what just the minister said before, that one aspect what we can do and maybe do better all together, helping or supporting the member states, all member states, it's really encourage the national cooperation, because it was said by the Minister of South Africa, it's so important that even on government level, the combination between the different departments could be really well done. And it's true that's my second point, it's related to the regulatory framework that you mentioned. Of course, that's not the most visible, even not the most expensive, but also so important and key in order to attract investment and procure a kind of safe or legal framework for the investor, which is of course key. And that's also something that we try to do in our assessment of the investment capacity of the countries. So that's also something where all of us in the six organizations, we can help through different lens. Thirdly, I think that the regional approach, as it was explained just now, is really by the Brazilian minister, is really important, because it's true that it's impossible to look at the things only on national level. So promote and encourage all the regional arrangements in order to develop this productive capacity on regional level is of course important. Fourthly, the question of the cooperation between WHO and the World Investment Forum that will take place in October. That's a place where all investors are there. And when you look at the fact that now a lot of investors are attracted for good or bad reasons, that's not the question, but by the investment in health, trying to guide those investors is really important, and we would like to work closely with WHO in this regard. Finally, you ask what could happen with the civil society. I think that not only the private sector for investment is important, civil society is also important, not only as beneficiaries, but also for the distribution of all those new products, and we have to prepare it before. I've seen, for instance, that some developing countries, and especially, I don't remember exactly which one, but especially in Africa, were not able to distribute the vaccine that they received from COVAX because of the difficulty to organize a distribution or vaccination campaign. That's not so easy regarding the different products, conservation issues, etc., logistic aspect. And it's why civil society could be really interesting partner to organize the place and the capacity to provide not only vaccine, of course, that's the most urgent issue, but globally for health issues, I think that civil society is key in order to really identify the places where it can be safely distributed and safely used. Also, it's not only a distribution issue, it has to be used on a proper way. So that's a really nice partnership that we have to develop with civil society, which is a nice task for civil society. So that's what I wanted just to highlight and ensure all the partners, and especially the representative of the member states and the minister in the room, that yes, this six organization partnership is working well. We will continue and enhance our efforts, especially now and pandemic, of course, make this arrangement more relevant than ever. So that's our responsibility to continue to work with you. We will. Thank you.
Thank you, Mrs. Duran. Thank you all the speakers for their comments, their participation, their suggestions, and also for the audience that continues to follow us. Before giving the floor to Ji Dong to conclude this session, just to say that this is a particularly important week because we still have 4 days of work on the First World Local Production Forum with a number of panels that bring back some of the questions that we just referred to. Particularly the regulatory one will be addressed tomorrow in a panel together with several regulators from the European Medicines Agency, FDA, but also others that will be present discussing these issues. And also because today we'll have an announcement, but I'm not going to do the announcement. It will be Director General Tedros on the press briefing that we will follow shortly during the afternoon, which is the materialization of some of the work that has been done at WHO in terms of facilitating the way forward for local production and technology transfer. But before closing, I will give the floor to Jisoo Dong, congratulating also Jisoo and the staff that with her at my department has been really the support, the strong support, not only for the Secretariat for the resolution proposed by the member states, but also for this organization that starts here, and that we want not only to do this during this entire week, but also to repeat with other member states, probably not virtually in coming years. Jisoo, the floor is yours.
Thank you, Director. So thank you, Dr. Swaminathan and Dr. Rogeria Gaspar for chairing this session. Dr. Rogeria Gaspar is a director in WHO for Regulation and the Pre-Qualification Department. Thank you so much. So also, thank you all, the interpreters, for your excellent work today. Thank you. This concludes the World Local Production for today. Tomorrow, we will start with the session 1, Building the Business Ecosystem for Local Production. Have a great day and evening ahead. See you tomorrow. Bye-bye.